Hey everyone, my name is Madison Davis. There are several educational theories that guide and shape learning, and today we are going to be focusing on and discussing the cognitive learning theory. Jean Piaget is a psychologist that developed the cognitive theory while spending his life studying the origins of human knowledge. In the 1930s, he found that knowledge is a process and he formed the cognitive learning theory. In his studies, he focused on how knowledge grows, and he found that the growth of knowledge is progressive, beginning with less powerful means to more powerful means. The cognitive learning theory focuses on the mental process of learning, and this theory views students as active participants within the learning process. Piaget's cognitive learning theory explains learning as something that is a process in the brain combined with previously known information and newly introduced information. This picture describes the process of cognitive learning. When something is being introduced to the learner, they compare it to previous knowledge that they already know. Then, learners are able to actively learn by being engaged, and maybe that means being hands-on. Once these two things take place, the brain will process and store the information. At this point in the process, the learner has not officially gained an understanding yet. Once the brain processes, the learner can begin to form connections between the new knowledge, the past knowledge, and personal experience that may relate to the information that has been received. After forming those connections, that is when the understanding and comprehension comes in. So I want to bring up an example. I want you to think about being a new grad nurse who begins their first job on a postpartum floor. The beginner nurse needs to learn how to assess a postpartum patient for postpartum hemorrhage. First, the nurse will remember things that they have learned before working on the postpartum unit. Maybe they learned that in nursing school what normal vital signs should be for a mother or an adult and the act of a fundal assessment. This would be the prior knowledge tab. Then the nurse completes a head-to-toe assessment of a postpartum mother with the presence and guidance of a preceptor. And this would be the active learning part because this is hands-on learning. And then after the assessment, the nurse will have to chart the head-to-toe assessment and will have to begin to process what is normal and what is not normal in their findings. This is processing. Then the student connects the assessment findings with the previous knowledge of postpartum hemorrhage and the palpation of a uterus, and this is when they form connections. Then at last, the student nurse can understand what a moderate amount of bleeding, small amount of bleeding, scant amount of bleeding, and what is entirely too much. This will essentially prepare them for the care of the postpartum mother and quick interventions for postpartum hemorrhage. And that's when the nurse will actually understand and comprehend. No learning theory can be perfect, even if one can seem pretty close to that. There are several strengths to using the cognitive learning theory to guide learning practices, but there are also some weaknesses noted. Strengths include promoting critical thinking, focusing on the process of learning itself, and encouraging problem-solving techniques. Weaknesses include that learning happens over time, it's not an instant thing, and it does require active engagement and participation from the learner. Now I want to jump into discussing a teaching strategy that pairs well with the cognitive learning theory. Problem-based learning is a teaching strategy that can be used by professors at the undergraduate, graduate, and doctoral level for healthcare-related careers. Similar to the cognitive learning theory, problem-based learning, or PBL, emphasizes heavily on the use of critical thinking skills to aid in learning and comprehension. Instead of a typical classroom lecture setup, problem-based learning thrives off of the use of collaboration within groups of students. Much like the cognitive learning theory, problem-based learning is a process where learners use their previous knowledge and newly acquired knowledge to bridge gaps and better their understanding. This teaching strategy and the learning theory primarily focus on encouraging the student to be active in their learning each step of the way. Ghani et al. 2021. Alright, now that we talked about teaching strategies, let's consider a teaching evaluation strategy that supports cognitive learning theory. I believe that a great way to evaluate a student's comprehension is through the completion of simulation skills labs. Simulation lab requires a student to connect knowledge with the newer learned knowledge and apply them to a real-world clinical situation. Kukarikos et al. 2021 found that the implementation of simulation enables students to practice their clinical and decision-making skills for some significant issues that they may face in their daily work. The protected environment and the sense of security can enhance a student's self-esteem and confidence, which then promotes learning. In this way, the gap between theory and practice is substantially reduced. Much like the cognitive learning theory, simulation requires critical thinking skills to complete the patient scenario. Upon the scenario being completed with a positive patient outcome, this can confirm the student's comprehension of whatever disease process that the patient is experiencing. Lastly, I want to compare Piaget's cognitive learning theory to Gene Watson's caring science theory. Cognitive learning focuses more on the process of learning, and it is used to promote critical thinking to solve problems. Caring science theory focuses on Gene Watson's 10 caring processes. It is used to promote human connections between patients and nurses. Cognitive learning theory provides a framework, whereas caring science can be described as the heart of nursing. I don't think that the cognitive learning theory aligns with the caring science theory, but if they are used together, whether that's in patient care or in nursing education, there will be more of a well-rounded care or education received. And this is my list of references. Thank you so much if you decided to watch my PowerPoint, and I hope that you learned about the cognitive learning theory and are able to use it to apply it to nursing and to your future in education. Have a great night.